Hey everyone. So we may have a few people trickling back in who are probably wrapping up their video watching. But I know we do have a few people in the room, and we'd love to hear their questions, but maybe we could just do a quick round of introductions. Looks like a small intimate group, discussion group we have here. Hi everyone, my name is Stacy Collins and I am with AMCHP. I am the Associate Director for the Health Systems Transformation Team. We're really delighted to have all of you here in our workshop, as well as our conference in general. And we have a lot of people coming in now, great. And I'm going to have my colleague, Infant-Toddler, introduce herself as well. And maybe we can just do a very quick round of introductions for the folks who are in the room.
Great, thank you. Hi, everyone. My name is Infant-Toddler, and I'm the Senior Program Manager on the Health Systems Transformation Team. I do see that we have a few folks trickling in to our live Q&A. So I'll ask our speakers to introduce themselves and for participants to type in where they're from in the chat and to type your questions in the chat as well.
Hi everyone, my name is Molly O'Neill and I'm one of the presenters for today's video, and I am with the National Resource Center for the Infant-Toddler Court Program, and I'll pass it to Rose so we can go in the order of the presentation.
Sure, thanks Molly. Hi everybody, my name is Rose DeMonico and I'm at RTI International. I'm a research survey scientist and evaluation researcher, and I work with Cecilia Casanueva, who will be addressing any questions or discussion today about RTI's research on our work that we did, and we were the evaluators for 0 to 3's Infant-Toddler Court Program. So I'll pass it to Nicole.
Welcome everyone. Hi, I'm Nicole Cook. I am with in St. Louis County, Minnesota, and I'm a Safe Baby Court Community Coordinator. And I'll pass it to my partner, Amanda.
Hi everybody, welcome to our Q&A. I'm the community coordinator for the Safe Babies court team in the southern part of St. Louis County in Duluth, Minnesota. So welcome. Cecilia, you're up.
Oh, hi, I'm very sorry. I with Rose Domenico at RTI International, and I'm the director of the evaluation of the infant court. So I'm here to respond kind of the technical questions on analysis and statistics, etc.
Great. Well, we're so pleased that you've been here and that you're here with us now, and for your excellent presentation. We'd love to hear comments, questions from some of the viewers, and in particular, give us your hi Lynn, Lynn Lee. Give us your reactions to the presentation. That would be great too.
Well, my name is Yelena. I'm from Illinois Department of Public Health. I'm a CSTE fellow, and so kind of new to MCH, but I just tuned in because I'd never heard of the program and was really interested to learn more about it. So I found it very fascinating and enlightening just to learn kind of the work that's being done and how it's, even through COVID, been very helpful for the kids. And yeah, so I really enjoyed listening and learning more kind of as an introduction to the program.
Thank you, Jelena.
Thank you, Elena. I just want to say that I'll put in to the chat, I had mentioned in the presentation that we have the Infant-Toddler Court Team approach is a best practice in the AMCHP Innovation Hub. And so I'll put a link to that because I know this one presentation, it was an introduction. So there's a little bit more information there for anyone that wants to learn more.
Yeah, that would be great. Thank you.
Yeah, and I want to add to that, Helena, that the information that was provided today, we're also working on trying to publish that information. So we have a manuscript that is under review that we hope will provide more detailed information about how we analyze what was happening the year before the pandemic compared with the first year of the pandemic. And we will have these manuscripts separated for children and adults. And then we're also working, and Rose can describe a little more about this, on the qualitative information, because there were a lot of challenges and it was very difficult during the first year for infant court. And of course, there were many things that were not working out, particularly when a number of services in communities were closing their doors and they didn't open again. So we have information on the good and the bad, and more than anything, our focus has been on trying to understand how infant courts have been able to rapidly face those challenges and adapt their practice to be able to serve families, even during the first year that one can think that was the worst of the pandemic.
And to add on to that, part of the evaluation that we did was doing the stakeholder interviews with the various court teams. So that involves the community coordinators like Nicole and Amanda, judges, caseworkers, social workers, attorneys, and these interviews were happening, of course, before the pandemic. And so we weren't asking about it, but then when the pandemic hit, we made sure to ask questions like, what are you all doing? How are you adapting and making this work? What has been challenging? What has been, maybe a benefit of going virtual? And so we asked a lot of questions of a lot of people and have tons of information on how the different courts adapted. So we'll have lots of quotes to hopefully share in an upcoming manuscript as well.
Excellent. I noticed that two people who just put a chat in the box are from states that are launching infant-toddler programs, I think Indiana and Alabama. And we're delighted that the project is featured in our Innovation Hub at AMCHP. I'm curious if you've gotten questions based on being in our database, if you've gotten questions from other states as they're trying to launch programs like this, and what kind of challenges are they facing that you're hearing about?
So for the Infant-Toddler Court program, the way that we work with states or local communities that are interested in building an infant-toddler court in their community or building the state's capacity, we connect them with, we have someone on our team who is in charge of outreach, and we connect them to that person. So I can provide that email address if anyone in this call really wants to start learning more about how do this was an introduction about what is this, but if you want to start thinking about how would we actually bring this to our community, we have really an expert on the team about how to do this and what information is needed for those that are interested in starting to do this work, and can talk about what those barriers are and challenges, and provide examples and solutions about how other communities have faced those challenges. And so I can put people in touch if that's of interest, or provide some information. So feel free to message me privately on Zoom or something, and I can send you that email if anyone's interested in that.
And thank you for the I just saw a question come in that I would totally like to address, and that's the how much the program has had involvement with the judges. Our Minnesota site really started with the judges, and so they've had really a really integral, there we go, part in informing our program. I see the comments of, you know, I hope this comes to Indiana, or I hope this comes to Alabama. And I think the important thing to think about is it all starts with one conversation. So somebody saw, hey, they're doing this in one state. And it was actually one of our judges clerks who said, what about us? And that is how everything started. And there were discussions and connections to 0 to 3, and people getting around tables. And that's really kind of the flame that we fanned in order to turn this into what it's been in our county. So I just highly recommend that folks, if you are inspired by this work, to take Molly up on her offer and just learn more directly from 0 to 3. I guess I could say a little more about judges. Sorry, that's kind of like the thing, right? Is that our judges just played such a huge role, because every there is an approach from 0 to 3, but it really is what you make of it. And so our judges had a lot of vision as far as doing something different, and we're really, I mean, they have power. Judges have power, and so yielding that in a way that helps inspire and bring people around the table was really a motivator in our community.
Yeah, from the perspective of the evaluation, I completely agree with Amanda. Having a judge as a champion is a huge asset, because they have so much power in the community, and they are such a convener, basically. But in the evaluation, we also have observed kind of the continuum from judges that are extremely motivated for the long run, and that really wants to provide this program for all of the young children that they are receiving at their court, and are pushing for the program to move forward. But there are also places where judges are lukewarm, has been approached, but are still skeptical. And I think that is valid too, and 0 to 3 works with those judges. And there are also places where the structure, the judiciary structure, is extremely rigid. So judges are not allowed any leeway during their hearings. And I will say that those are places that are particularly challenging. When judges have authority to decide how they conduct their hearings, how much depth, how much time, how frequent is the contact with the infant court teams and the families is easier. But there are a few states that, as I said, are so rigid that in one state in particular, we haven't even been allowed to interview the judges, because not even that is permitted. We're grateful that it's just one state. Everybody else, we have been able to interview judges, and we have also seen their perspective change, and from being very skeptical, and I think Rose can talk about that. She has done a number of interviews with judges, and being very reticent to really describe when we go back in subsequent waves to interview them, that they have changed to their own surprise.
Yeah, there was one example where at the beginning the judge said, I'm doing this, I'm committed, I just don't know about this. It's very different than how I run my court. So I'm going to try my best, but I don't know about this, and was kind of weary about it. And then when we spoke 6 months later, that judge said, I've seen outcomes and I've seen how this really works, and I'm changed. I have changed my mind about this. So that was really cool to hear that firsthand from that judge. So.
Excellent, thank you. I encourage others to put their questions in the Q&A box, and I have another question here as well. Can you tell us a little bit about data you have collected from families that have gone through the Infant-Toddler Court program, who have spoken about their own experiences?
Yeah, we have a section of our evaluation where we try to reach to both parents and caregivers. And it's still a structured interview, so we try to obtain data about the child well-being and the parent well-being. And it is not an easy task. Usually when parents, they have to sign a consent form first with community coordinators. And then they again have a shorter consent form with us. And in general, parents are very reticent to talk with anybody. It is in their mind constantly the issue of what they may say that may prompt a new report to Child Protective Services. So there are challenges. Nevertheless, we have been able to interview some parents and some caregivers. We are currently trying to go back to them and complete a follow-up interview. In general, we try to do it when the case judicially is closing. But because we are in the last year of the project, we are going back regardless. If they have been open for more than 12 months, we want to know how are they doing. And of course, there is parental depression. Of course, children have different behavioral and emotional problems at baseline. There's no doubt that it's a time of huge crisis for families.
I can add some more to that too. So, you know, it's adding to what Cecilia said, it's a really sensitive survey because we're asking how they're doing, how their baby is doing, and especially if they've just joined the program, they're in the thick of hearings and kind of trying to just get all their stuff together. So being asked really personal questions is pretty difficult. And we do offer an incentive if they complete it. And we try to make it clear in the beginning that, you know, this is totally separate. Anything that you say to me, you know, your community coordinator, you're the court has no, you know, they don't know your answers to this, and try to do a good job at explaining why it's important to do these interviews. Again, it's really hard to get them on the phone. And we ask questions if the baby is older, 12 months or older, we ask questions about various behaviors that they might be exhibiting. Like Cecilia said, maternal or paternal depression, whether they're covered by health insurance, things like that. And then also once COVID hit, we started asking about the impacts of COVID and their stress levels, so we could measure that as well.
I'll also add to that because as Cecilia and Rose said, you know, it can be really difficult to gather data from families who are, you know, in the midst of experiencing this, you know, highly stressful time in their lives. So we also engage parent voice and those with lived experience in that we have a national advisory group for Parents' Voice that informs, you know, our work for the Infant-Toddler Court program at the national level. And we, you know, work with them, some of them who were parents that went through, you know, an infant-toddler court, others who have had experience or are peer mentors with, you know, young children. And so we do go to them and ask for feedback and have them, you know, about what it is that we're doing and our approach, and work with them really closely to really be leaders in the field and to provide us that feedback when they're a little bit more far removed from this really highly stressful time. So I just wanted to add that we are doing that, and we'll be working with Family Voices. I saw someone here is from Family Voices to
Molly, I think you've broken up a little bit.
Yeah, it looks like she got disconnected.
Okay.
Oh no.
Oh, there you go.
Oh, she's back.
You want to finish your thought? You're cut off for about 30 seconds.
Oh no, I just got the pop-up, your internet connection is unstable. Let me shut off my video. Maybe that will help. Sometimes that will help. I was just saying, I don't know if you heard the piece about that we'll be working with Family Voices to hopefully increase and increase our capability at the National Resource Center, but also to support our training and technical assistance with sites and states to be able to increase their capacity to work with parents and those with lived experience and to raise up, parent leadership at our infant-toddler courts and the states. So we are taking some steps to really increase that capacity around working with families once they have, passed that point of connection with the child welfare system.
Excellent, thank you. Great answers. Is there anyone else? We have about 4 minutes left in our program who'd like to ask a question of our speakers. Sorry about that. I just want to say thank you so much to our panel of speakers. That was an excellent Q&A, and thank you so much for all the work you put into the presentation. I think everyone has the speakers' email addresses if they wanted to have any follow-up conversation or questions. But anyway, on behalf of AMCHP, we hope you have an excellent rest of your conference, and we look forward to seeing you all again. Thank you so much.
Thank you.
Bye-bye now.